Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India. I would like to welcome you all in my Ayurveda Academy YouTube channel. Actually, as you know that I am MD in Ayurvedic medicine, that is Kaya Chikitsa, and MD in Ayurvedic physiology, that is Kriya Sharira. This lecture is basically related with the Roga Nidan subject of the BAMS students, but these all the lectures are very useful for the students as well as for the doctors and also the common man to understand what Ayurveda are talking about the different diseases. So today's topic is related with the Kushtha Vyadhi. Actually, in for the students' sake of the understanding, in the Roganidan paper 2, there are nearly, according to my list, 35 to 40 very, very important diseases that each student should take the note of it. That means they should remember. I will just narrate. In the last lecture also, I have explained which are the diseases and how many percentage it has. But now today, only I will go and narrate that particular list of important diseases for the university examination. Number one, of course, the Jwara is called as a king of the diseases. So Jwara means fever. Second, Tamaka Shwas or only Shwas. Shwas is a breathlessness or the dyspnea, and Tamaka Shwas can be related with the bronchial asthma. Rakta Pitta that we have already talked about. We have the video of Roganidan and also my video on the Charaka Samhita Chikitsasthan, Rakta Pitta and Gulma. That videos are available. So Rakta Pitta are nothing but bleeding disorders, Urdhvaga Rakta Pitta, Adhoga Rakta Pitta and Tiryak Rakta Pitta bleeding disorders. From the blood from the vomiting, blood from the nose, blood from the sputum. So there are hematemesis, hemoptysis, etc. Ardita, see my face, facial nerve paralysis, Ardita. That is a small subset of the Pakshaghat. It is not actually Pakshaghat. Paksha means extremities, and when we lost the power of the half body, that is the right hand, right leg, etc., that we call as a Paksha Vadha. Paksha is extremity. That disease is also important, but Ardita is a very local phenomena that is only related with the face. Kamala, that also we have covered, that is infective hepatitis. Ruddhapatha Kamala and Bahupitta Kamala. Then Amlapitta, simple hyperacidity type of complaints. Apasmara, epileptic fits. We have discussed in the Balrog, febrile convulsions. Do you remember that convulsions? Then Krumi, that is the worms. Basically, in Ayurveda, there is a different understanding, right? Purishaja Krumi and Raktaja Krumi, etc. But in general, in our body, there is a roundworm, threadworm, hookworm, and tapeworm. Then Atisara, Gudena Bahudravasaranam Atisaraha, that is loose motions. Vatarakta, that we have already completed, that is rheumatoid arthritis, and also some people, rather most people, take it as a gout, G-O-U-T, gout. Then Udara, most probably the next lecture will be of Udara, that is ascites, the problem of liver cirrhosis, and afterwards Udara. Then there is a Kas, Kas is a cough, then Vataja, Pittaja, Kaphaja, etc. Then we have the Ajirna, simple Vyadhi, indigestion. Kushtha, that we are today talking about, is the maximum time asked disease. That's why I am taking this Kushtha. 10 times the question has been asked. Sometimes Hetu, sometimes Samprapti, sometimes Lakshana, etc. And sometimes LAQ, Nidana Pancha Panchak. Nidan, Purva Rupa, Rupa, Upashaya, and Samprapti. For all the 5 things, you have to write down about Kushtha. Okay. Next is Hikka. That is hiccup. Hikka is a hiccup. Pranava Srotas Vyadhi. Shoth, that is edema. Then Visarpa is like erysipelas or cellulitis. Amavat, some people consider as a rheumatoid arthritis. Some people they consider as a rheumatic fever. Okay. Hridrog, cardiac problems. Pravahika, Pravahamanasya Pravahika, straining while defecation. मराठीमध्ये संडासच्या वेळेस कुंथणे, गिव्हिंग द प्रेशर, अँड देन स्टिकी म्युकस इज कमिंग आउट, that is pravahika, amoebic dysentery or giardiasis. Grahani can be compared with many diseases: enteritis, colitis, irritable bowel syndrome, etc. Mutraghat and mutrakrichr. Mutraghat is oliguria and mutrakrichr dysuria. Gridhrasi, that is sciatica. Pandu, that is anemia, hemoglobin is less. Dah, burning sensation. Medo Roga, that is obesity, overweight. Sandhigatvat, that is osteoarthritis. Rajyakshma, compared with the tuberculosis. Vishamajvara, compared with the malaria that we have already discussed in the Swasthvrutta lecture. Unmad, that is hysteria. In nowadays, in spite of hysteria, some psychologists call it as a ACR, capital, that is acute conversion reaction. Arsha, that is hemorrhoid or piles. Sannyas, that is coma, deep unconsciousness. Prameha, that is diabetes mellitus, especially prameha means all urinary problems. In 20 prameha, that is madhumeha, that is diabetes mellitus. Apasmara, epilepsy, and Pakshavada, Shita Pitta, that is urticaria. Firanga, syphilis. Shvitra Kushtha, that is leukoderma. And Plihavruddhi, splenomegaly. I think this is the list that you must remember all the time with you. And today we will start with the important disease, Kushtha. Please write down the title, 19th February 2024, Roganidan lecture, Kushtha Vyadhi. Here, there is a difference in colloquial language and paribhashika saudhya. Colloquial language, that means boli bhasha, what the people talk or the government talks about. Kushtarogi kalva, 1000 rupaye melwa. Slogan in Marathi of government outside the wall of the PHC, Primary Health Center. कुष्ठरोगी कळवा, 1000 रुपये मिळवा. Government is appealing to the people, if anybody nearby you is suffering from leprosy, because it is a contagious disease, inform to the corporation, and then we can give you 1000 rupees. Why? Because you have done a good job. Come on, good job. But this Kushtha mentioned on the wall is not that Kushtha mentioned in Ayurveda. OMG, oh my God, what is that? Yes, in Kushtha, in Ayurveda, all skin diseases are involved, and one of the skin disease is leprosy. So Kushtha includes leprosy, but Kushtha is not only is equal to leprosy. It can be fungal infection. It can be leukoderma. It can be scabies. It can be eczema. It can be psoriasis. Everything Kushtha word in Ayurveda. Now there are the different types that we are going to see. First is a definition. Kushnati vapuhu iti kushtham. Tvachaha kurvanti vaivarnyam. Discoloration. Vaivarnya, color, normal color has lost. It may be dark, black, white, cyanotic, whatever it may be, the different colors, brown, red, okay? So, Kushnati is a blackish discoloration, but Vaivarnya, any discoloration. Dushtaha kushtam ushanti tat. Kalena upekshitam. Kalena upekshita. Upekshita, negligence. Yasmat sarva kushnati. All the diseases that turn into blackish discoloration. Tad vapuhu. Vagbhat Nidanasthan. Ashtangarudaya Nidanasthan 14/3. Mainly Charak Chikitsa Sthan, this word is indicating specifically leprosy. Samyak Visheshtaha Sparshada Dhanam. Sparsha, touch. hypopigmented patch on the skin here or on the back or on the abdomen, and doctor takes the little bit pin. Are you feeling that touch? No, doctor, I am not feeling any pain. Oh, that's dangerous. That is dangerous. Patient is not feeling sensation and hypopigmented patch. Most probably it is a Hansen's disease or leprosy. Remember these words. Okay. So any hypopigmented patch, get it checked by the doctor if it is on the backside, or otherwise you can check by your relatives or the friends. Sensations are there, no problem, nothing to be worried. But no sensation and hypopigmented, it can be, I am not saying 100%, it can be leprosy. Sparshana jnana. Vitiated doshas, that is vata pitta kapha, they cause vaivarni, discoloration in tvacha. And due to the negligence, afterwards, that particular part becomes decay, gangrene, less of oxygen, less of blood supply, totally black. And if it is not treated, cut it, throw it, amputation. Especially I am talking about leprosy, or it is not removed actually, it is not removed unless and until it is a surgical gangrene, nothing can be happened. Here you lose that particular part. Fingers are lost, nose tip is lost, etc., etc. That we will discuss afterwards. Here, decay or the rotting is called as a koth in Sanskrit. Koth. Hence the name Koth Kushtha. Koth Kushtha. Very near. Very near. Koth Kushtha. Koth Kushtha. Are you getting? So primary Vikruti is that of Sparshanendriya. Tvacha is a Sparshanendriya. Tactile sensation. If you remember the nervous system, there is an ascending pathway. Oh, sir, please don't go nervous system. We have forgotten. Okay. But ascending pathway, and that is tactile sensation. Okay. Going to the brain. Now, next we will see about the Vyadhi Swarupa. Can you see here? What is the nature? Darun is a chronic. Chirakari, it goes from month, years together. Many months, many years. It is not like cold and cough. 2 days, 3 days. No, it will go wrong. Long run. That is why this is very interesting story that after 12th, or I'm sorry, after MBBS, a group of 3-4 students, doctors, they were discussing where are you going, which post graduation you are taking. One is saying physician, another is saying I am MS in surgery, MS in ENT, MS in psychiatry, MD in psychiatry, MD in cardiology, etc., etc. One say I am going to do the only dermatology. All are very surprised. This is not a very demandful branch. Why you are going to dermatology, skin problems? He said that there are 2 advantages. Kindly note this point. There are 2 advantages of dermatology. No emergency. This is partially wrong. I am just joking. So he says there is no emergency like the physician, ICU at night. No. Patient is dying. Nothing. Very rarely. So no emergency, first advantage. And second, these patients are not getting cured at all the time. So always there is a recurrence. Coming up, okay, again coming up, okay, again coming up. So these patients are permanent, lifetime patients are there. So that's why I said I will take the dermatology for MD. So this is apart from the joke, but this is sometimes this is very true because it is very chronic. Vyadhi Marga. 3 Vyadhi Marga, you remember? One is a Abhyantara Marga, Bahya Marga, and then what you can say, third is a Marmasthi. That means very serious. So this is Bahya Marga, related with the skin or Rakta Dhatu. Okay. Now we will go for types. Mainly 2 types. I request all of you to write down these 2 types. One is Mahakushtha and another is a Kshudra Kushtha. Very important. AIPGET, entrance examination for MD and MS. You will have to write down Mahakushta 7, Mahakushta 7, Shudra 11. MCQ question. Whenever there is a number, it's a MCQ. Whenever there is a definition, it's a MCQ. Whenever there are types, MCQ. And especially AI, PGT, this chart is important because there is a comparison of Charaka, Sushruta, and Vagbhata. For UG students, I will request that you remember only the Charak. Forget at the moment. In the first round of study, you remember these names because they are also a little bit complicated. Okay. Kapal, Audumbar, Mandala, Rishyajiva, Pundarika, Sidma, and Kakanak. I will modify. I am just concentrating or marking this part. So, my students are requested to write down immediately at this moment. I will wait for 1 minute. Can you see? Kapal, number 1. Audumbar, Mandala. These are the names, Sanskrit names. We will see the meaning. Rishyajiva, Pundarik, Siddhma, and Kakanak. You have to remember by heart. तुम्हाला पाठ करावयाचे आहे. आपको याद करना ही करना पड़ेगा. बस. Kapal, Audumbar, Mandala, Rishyajiva, Pundarika, Siddhma, Kakanaka. You can make by your own mnemonics. If anybody is knowing mnemonics or want to make mnemonics, please write down in the comment box. I will be welcome him and I will be obliged. So you can take one first letter, Kamr, like this, Kamrap SK, Shahrukh Khan, Kamrak SK. So such type of the tricks you can remember. Take the only first letter, Kamr, K-A-K, Kamrap SK, Kamrap SK. Please write down, Kamrap SK, Kamrap SK. Kapal, Audumbar, Mandal, Rishyajiva, Pundarika, Siddhma, and Kakana. Okay. Now I am requesting you to write down the 11 names of Kshudra Kushta. First, I will try to mark, and then if you want, you can write down. I'm sorry, because it is a second page. So, Ek Kushtha. First, you write down these 5 names. Ek Kushtha, Charma Kushtha, Kitibha, Vipadika, Alasaka. Ek Kushtha, Charma Kushtha, Kitibha, Vipadika, Alasaka. Next. Here you can write down these names. Dadru, Charmadala, Pama, Vispota, Shataru, and Vicharchika. Dadru, Charmadala, Pama, Vispota, Shataru, and Vicharchika. Now, I would like to give some parallel modern dermatology words. Please write down, my students. Please write down. For Mahakushta, many of the Mahakushtas are the part and parcel, the different types of leprosy. At the end of this lecture, I have made some handwritten note also that I am going to show you. But first you write down Mahakushta can be compared with leprosy. Okay. Now here, some words I can, not for all, I can give some words. For example, although it is not here, but Siddhma, please write down. Siddhma, Kushta. Siddhma is also called as a Shiba in Marathi. That is Tinea versicolor. Tinea versicolor. Now, can you see here Dadru? Please write down. Dadru can be compared with ringworm, that is fungal infection. Dadru can be compared with ringworm. Okay, Dadru. Can you write down, please? Then here, Pama. Please write down. Pama can be compared with scabies. In Marathi, we call it kharuz. इथे बेचक्यान मध्ये होतात, here in the fingers web. So Pama is a scabies, SCABIES. Then Vicharchika, please write down here Vicharchika. Can you see here Vicharchika? Eczema. Vicharchika can be compared with eczema. Okay. Then here, can you see here Kitibha? Kitibha, can you see Kitibha? Please write down. Kitibha can be compared with psoriasis. Spelling is PSORIS. Kitibha can be compared with psoriasis. Okay. So whatever I found very easily, that I have given you the note, then rest we will see afterwards. So there are actually innumerable Kushtha, many types of the skin diseases. But mainly there are Saptavidhani and Ashtadashavidhani, 7 and 1, 8, 18, and Aparisankhya. This is from the Charaka Nidanasthan. First answer should be Aparisankhya. Now, why this Kushtha is causing? We will see the reasons. The important is here involvement of Rakta Dhatu. Please write down Rakta Dhatu and Pitta Dosha. So Pitta Dosha is attacking on the Rakta Dhatu, any skin disease. So you must write down the Pitta Prakopak Ahar and Vihar. Please write down Pitta Prakopa. Hot, spicy, pungent, sour, salty, very hot, alcohol, cigarette smoking, more screen time, excessive hot tempered, excessive stress, keeping late at night, going to the bed at 1 o'clock, 2 o'clock at night. That is very bad. Smoking, everything, working near the furnace, working in the hot sun. So all these causes will definitely give you the problem of skin diseases. Skin diseases, that is Kushtha. So here you can see, basically there is a problem of arm, Kled. Write down these words, arm and Kled. So that is a indigestion, faulty metabolism, Viruddha Annapan, important cause, very important cause. Please write down incompatible food stuff like Desha Viruddha. If you are living in the Nagpur, very hot, and regularly you are taking the garlic chutney, lasnachi chutney every day in the hot, that is a Desha Viruddha. If you have the Pitta Prakriti and if you are eating daily garlic or the pickle, mango pickle, raw mango pickle, it is Viruddhan. Kala Viruddha, it is hot outside summer, now April, May, and you are eating green chili and the spices and the garlic, very bad. You will get the skin problem, definitely. Okay. Then another important is a Vegadharana. Vegadharana. Na vegan dharayet vat vitmutra kshavatruchudam nidrakasa shramashvasa jurumbashru chardiretasam. Na vegan dharayet vat vitmutra kshavatruchudam nidrakasa shramashvasa jurumbashru chardiretasam. At least you should not avoid to go to the toilet, go to the latrine, eating, kshuddha, hunger, thirst, should not stop it. Then excessive vyayam after meal, continuous exposure to the sun. Only important thing I am going to tell you. Then these are the different, you can read afterwards slowly and you can take the snapshot. But basically curd, that is very bad. That is Kleda Prakopa, by which secretions will increase. Abhishandi. Can you write down this word? Abhishandi. And in the leprosy, if it is we are talking about leprosy, then Mycobacterium, I will mark for you. Can you see this one? Mycobacterium leprae. This is the name of bacteria which cause the leprosy disease or Hansen disease. Leprosy is also called as a Hansen's disease. All these diseases are important in Roganidan, in Swasthavrutta, in Balaroga, in Striroga, and in also Charak. Charak also we have this Adhyay. Kushtha, we are not going to see that because it is already covered. Tell me in the comment box, sir, it is repetition. Okay, so this is a Hansen's disease. Now we are going to see very important, that is pathogenesis. In Ayurveda, it is called as a Samprapti. So let us see the Samprapti. Because of the Hetu, the Dosha Prakop, Prerita Malaha. Here Mala means not stool and urine. Here Mala means Vata, Pitta and Kapha, Dushita, Prakupita. Siraha Prapadya. They move with the blood circulation. And they attack on Tvaga, skin, Lasika, internal secretions, Asruk, blood. Dushayanti Shlathikritya. All the tissues, they disturb in their functions and quality and quantity, and they become laxity. Their functions will not be proper. That is Dushayanti to all the dhatus. This is from Vagbhat Ashtanga Hruday Nidan Sthan. So vitiated doshas, due to the different causes, they spread in the tiryak manner through the rasa and raktava circulation, and dushti of tvacha, dushti of lasika, rakta and mansa, causing shaithilya. And this leads to the vaivaranya, discoloration, and important lakshan is also kled dushti is there. Write down this word, kled. Okay. Now we will see according to the charak. What charak is saying about the samprapti. Just a few minutes to me, because Dr. Deshpande is giving a very nice focus. Now here the most topic is there. Very important. I request all of you, write down Kushtha Sapta Dravya Sangraha. See my cursor on the screen. Sapta, 7. Dravya Sangraha. Which are the pathological elements in the Kushtha Vyadhi? They are 7. Please write down those 7 immediately. This is for SAQ. This is for oral. This is everywhere. Saptako Dravya Sangraha. Likhata. Describe Saptako Dravya Sangraha in a Kushtha. Likhata. Describe, write. Saptako. Saptako Dravya. Saptako. 7. Pathological elements. You make the numbers. Number 1, Vata. Number 2, Pitta. Number 3, Kapha. So very easy to remember. Out of 7, 3 are doshas. Then 4, Lasika. 5, Tvacha. 6, Rakta. Very easy to remember. And is Mansa. So 4 dusha and 3 doshas. Total 7. This is called as a Saptako Dravya Sangraha in Kushtha Vyadhi. This is must to remember in SAQ and also for oral examination. Okay. Next. Now, this is very interesting one point. Visarpa is another Vyadhi. Visarpa. There is always a comparison. Visarpa Kushtha. Visarpa Kushtha. Visarpa Kushtha. Sir, why comparison? Because Saptako Dravya Sangraha same. Saptako Dravya Sangraha same. Kushtha. Yes. What? Visarpa. Kushtha. Visarpa. Kushtha. Visarpa. Kushtha. Visarpa. Saptako Dravya Sangraha same. That is why in examination describe the similarities and differences in Kushtha and Visarpa. Because pathological elements are same. But only there is a taratama bhav. Can you see? Comparative. Sometimes here Pitta Prakop is more, in Visarpa Pitta Prakop is more, in the Kushtha Vata Prakop is more. Something like that. Okay. Now we will see the prodromal symptoms of Kushtha. How we get the understanding. Oh, be careful that you can get the skin problem. How you can understand? There may be sweating problem, either excess or no sweating. Sweating problem, excess or no sweat. Then tvacha becomes soft or skin becomes rough. So softness or roughness, extreme, I am talking about extreme polarity. Then there may be tvak varna, color change will start. Then there may be burning sensation intermittently. Itching will be there. Lack of touch sensation. Sometimes pain will be there. Then koth, like a maculopapular eruptions will be there. Wounds will be maybe infected. Then Roma harsha and dark colored blood are the Pururupa of the Kushtha Vyadhi. Okay. Now we will talk about the Rupa. That is actually the symptoms and signs. These 2 lines from Charak Chikitsasthan, very, very important. Chapter number 7, Kushtha Charak Chikitsasthan. When we will learn Charak, I will not repeat this chapter because it is already covered. Okay. So, you write down Rupa, very simple to remember. Vaivaranya, discoloration. Vispota, like edema. Kandu is always there, itching. Dah, burning will be there. Inflammation, shoth will be there. Then srav, secretions will be there. Vrana, sometimes wounds. For example, varicose veins, there is a stasis wounds are there. Huh? Lack of sparsha is specifically for leprosy. So these rupas are very easy to remember and commonly seen that in any skin disease you can get these problems. Then there is a description of each type. So let us start with the Kapala Kushtha. Only important things you remember. I am going little bit fast just to remember only important point. So I request whenever I mark something, be fast in writing. Kapala Kushtha Vata V. Write down only V. Kapal V. Kapal V. And when V Vata, naturally black color will be there. Spreading nature will be there. Roughness will be there. And though the Vedana will be there. Vedana will be more than Kandu. Vedana will be more than Daha. Kandu is common in Kapha. Daha is common in Pitta. But this is Vata. Sometimes krimi can occur. Some microorganisms or that small creatures will be developed in this roughness because of the roughness. Okay. Now we will go for Audumbar. Second type of Mahakushta. Please write down the name. Please write down name and the important doshas. We will see only important things. For example, Audumbar Pitta. Audumbar Pitta. Very important. P. Write down only capital P. First was V. This is P. Red in color. Then here you can see Adhik Rakta Varna will be there. Then Puyastrav, Pas will be there. Strav is a speciality of Pitta dosha. Can you give me 1 minute because there is some sound. I will like to check that. So whenever there is a pitta, there is always red in color, inflammation is there, strav will be there, kandu will be there, because whenever there is a strav, oozing, eczema, always there will be itching. Okay, clay is more. So daha, pak and krumi. These are the words, daha, pak and krumi. Next we will see mandala. Third type. Mandala kapha. Sequentially, first was vata, then was, can you see? I will just trying to mark this point. Okay. Can you see here? So mandala K, capital K. Shveta, Pichila, Pichila straw, sticky. Stickiness will be there. Then snigdha, excessive kleda, excessive kandu, excessive klumi. Only important thing you remember, my dear friends. Not all the things. Don't remember all the things. Then you will not remember anything. So only important things. Now we will go for next fourth type. That is Rishya Jiva. I will mark for you. That is Vata Pitta. VP. Please write down VP. So naturally there is a red because of Pitta and black because of the Vata. Then Mandala. The patches are oblong. Then there is a lot of eruptions. There is a lot of eruptions. Then Kandu and Kled, because there is no Kapha. Kandu and Kled is less. Then Daha is more, Veda, Vedana will be more, and Paka, inflammation will be there. Rushya, what is the name? Why there is Rushya? Rushya is a one type of deer, is an animal. And Jivva means tongue. So this particular patch of this skin disease, it's looking like the tongue of the deer. Tongue of the deer. That is called as a Rushya Jivva. Huh? So it is very interesting to note this point. Now we will go next for type of Mahakushta. That is the fifth point. I will just make a little bit smaller. So that, okay, here, can you see? I'm trying to adjust the screen. Yes. Now this is Pundarika. Can you see here? PK, Pundarika, P and Kushtha K, PK, Pundarika Kushtha PK, easy to remember. Then this is Pitta reddish, but in the center white because of the Kapha. Shape is like a red lotus. Pundarika, Sanskrit word meaning in English is a red lotus. Pundarika, red lotus. Pundarika, red lotus. Lakshanas, both Kandu, Dah, Pak, and Krimi. Because of the kapha, there is Kandu. Because of the pitta, Daha, Paka, and Krumi. It is fast to erupt and spread. Pundarika, because the blooming of the lotus flower. Next is a Siddhma. Can you see? Siddhma. 6.6. This type is Kapha Vata. You always remember, at the last I have made this list, Kapha Vata. So Kapha, that is Vata, Ruksha, Rafa, and Kapha, Snigdha, and Shlakshana at the center. So it's a mixture. Always remember, you just remember the dosha, and accordingly you can write down the symptom. No necessary याद करने की, लक्षण याद करने की कोई जरूरत नहीं है. Need not to remember all symptoms, only you have to remember the dosha pradhanya in each type. Make a jodi banao, pair, make the pair of the name of the disease, that is Kushtha, and write down the dosha in front. I have made in this video at the last. I will go fast and we'll reach there. Okay. Here, can you see? Color is reddish white because reddish is not actually the expected color because it is a kapha and vata. But sometimes some are exceptions. Kapha is a white, that is very clear. Flower of bottle gourd plant. This particular Siddhma is looking like simile, drishtanta, example. Flower of bottle gourd plant. Please write down. Flower of the bottle gourd plant. So Lakshanas, because of the Vata, there is a Vedana. Because of the Kapha, there is a Puya. Because of the Kapha, there is a Kandu. If you forget Daha, no matter. Because there is not much Pitta is there. So Daha, you can forget about that. Okay. Then mostly on the chest, the region is more important, back and on the throat area. Sushruta has given this particular, this is Mahakushta according to Charak. But Sushruta has given under the Kshudra Kushta and he has mentioned it is only Kapha Pradhana. There is a little difference here and there with the Charak and Sushrut. Okay. Now, Kakanaka. Kakanaka. This is Tridoshaja. So, red similar to the Gunja Bija, Gunja. And it does not cause Paka but has the Tivra Vedana and Daha. This is the speciality. Tivra Vedana and Daha. Okay. And other Lakshanas are according to the Tridoshas. Next. Next is a Dadru Kushtha. Dadru. Sushrut. Just give me a few minutes. Included in the Krishna Varna Kushtha and Mahakushtha category. It is also known as the Asita Dadru Kushtha. It spreads to Gambhira Dhatu. That means Asthi Majja Shukra and Asadhya in nature. Dadru is Asadhya. According to the Charak, the Dadru Kushtha included in the Kshudra Kushtha. You see the difference. Sushrut and Charak has the difference. Sushrut has included in the Mahakushta, but Charak has included in the Kshudra Kushtha. Charak is, so there may be some different skin diseases they are talking about, but there is a controversy in this Dadru. So you know, that's why other types you just try to remember this controversy, difference of opinion. Siddhma according to the Sushrut. This is incorporated under the Kshudra Kushtha category. It is Sadhya and is restricted to the Bahya Tvacha only. It is known as a Shiba in colloquial language, Siddhma. Now we will directly start with the Kshudra Kushtha. Some I have dropped at one point. Kshudra Kushtha. Now again, just remember only dosha pradhanya. Eka Kushtha, Vata. That is, appears like the scale of the fish. Scale of the fish scales. This is the Bahya Tvacha. Next, Charmadala or Charma Kushtha, that is a Vata Kapha, VK, VK Pradhan. Varna and Sparsha resembles that of elephant skin. That is why Charma, Charmakhya, Charma Kushtha, elephant skin and is rough and dry. So some examples you must remember. Here fish, here elephant. Now Kittibha, that is Vata Kapha. Vata Kapha. Varna is a blackish and Sparsha is rough, and Atikandu. The specialty is Kitibha Atikandu is there. Next is Vipadika, very common disease in our general medical practice. Just give me a few seconds again, my dear friends. Can you see Vipadika? Here, cracks on the palm and sole. Tivra Vedana, if they are break, then Vedana. Alpakandu is there. Then Alasaka is Vatakaf, VK. Reddish, not like eruptions, and there is a Kandu. Dadru is a Pitta Kafa Pradhan. Reddish eruptions are there, and excessive Kandu is there. Then Charmadala, this is a Pitta Kafa, PK. Then Rakta Varna Kanduyukta eruptions are there, and Tivra Sparshasa. This is very important. And Dah is also present there. Okay. Now we will go further. That Kshudra Kushtha. Pama is a Pitta Kapha Pradhana, whitish eruptions, open to secrete the Strava, Pama. Vedana is a Tivra, and Kandu is also there. This is in between the spaces. The Pama is scabies. Please don't forget. Pama is very common. Pama is a scabies, very contagious. In one of the family member is there, keep his clothes and all these things separate, because this can spread from one to another. And even the doctors treat all the family members at the same time. I am very sorry, but I don't have the much time to discuss the treatment part. When you will go for last year, 4th year BMS, you also can join my classes, and there I will teach you how to treat this particular all the problems. But now I will restrict to only Roganidan subject. Vishofa is a Pitta Kapha Pradhan and thin skinned eruptions all over the body, and color is reddish white. Then Chataru. This is innumerable, hundreds. Pitta Kapha Pradhan, innumerable small ulcers, Vedana and Dah are near. Small holes like structures, sinuses are formed. Like carbuncle. I can give you the diabetic carbuncle are like a Shataru. Innumerable sinuses are created. Then Vitarchika is having the Kapha Pradhan and Shava Varna, Pitta and Vitstava, and Kandu is primary lakshan of Visarchika. Now, here the another type of the explanation according to the Doshaja Lakshana in Kshudra Kushtha. I think it is not necessary to go on detail, because we have already seen these, that Vataja, then there is a Varna is a black color, lot of Vedana is there, stretching pain is there, rough in nature, skin wrinkling will be there. Only important. Pitta, red color, red pink. Dah, burning. Strav, Paka, inflammation. Durgandha. You remember the properties of Pitta dosha? Pittam sa sneha tekshnoshnam, visram saram dravam. Visra, typical smell. Pitta is always with the smell. Pitta is always with the odor. Remember this thing. Okay. Then wet, rottening. Gangrene is possible with the Pitta. Then Jwara, Atisveda, with Kapha, then a white color, Shita Sparsha, and Chirakari. Acute, any skin disease is Vata Pitta. Chronic, always Kapha. Chronic, always Kapha. Now here, very important comparison of Visarpa, Vatarakta, and Firanga are very similar Vyadhi to the Mahakushta. Now, Kushtha and Vatarakta we have already discussed. This can be compared with the type of arthritis. Vatarakta. This is compared with the gout and RA, rheumatoid arthritis. So here you can see Uttan and Gambhir types are there. Vatarakta also Uttan and Gambhir. Then no Doshaja types. But here Vatarakta, Vataja Vatarakta, Pittaja Vatarakta, Kafaja is there. Then Sandhi Vikruti is present in Dhatugata Avastha, only at the late stages. But here, Vatarakta, there is always primarily skin problem. So Vaivarnya, Kandu, Dah, Sukti Lakshanas are present in the Kushta, but primarily Vikruti is seen in the small joints. In Vatarakta, metacarpophalangeal joints are affected. We have already a lot discussions on the Vata Rakta, so you please check that video again. Now here is a comparison of Firanga means syphilis. Please write down. Firanga, coming from the foreigners. Firanga. Upadamsha, these are the two diseases always asked. Firanga is a syphilis and Upadamsha is a gonorrhea. According to modern science, these are sexually transmitted diseases. We have in Swasthavrutta, please check the playlist of Swasthavrutta. We have the video on STD and all we have discussed a lot. In Firanga, there is an ulcer on the penis but is not painful. So here, Kushtha is a contagious, Firanga is also contagious. That means from husband to wife, wife to husband, from prostitutes to the person, man, it can be transferred. Types of Mahakushta and Kshudra Kushta, but Firanga types are different, Bahya and Abhyantara. In modern science, there is a primary syphilis, secondary syphilis, and tertiary syphilis. Loss of touch sensation. Here, touch sensation is not lost, but Vispota and Vrana appears not on skin, it is on the penis, it is on the genitalia. Firanga Vyadi. Next, comparison of very important comparison. This is asked for the SAQ. Please remember my words. It will be asked for SAQ. Kushtha Vyadi is a sthira and chirakari. Visarpa is a chanchala, very spreading, and ashukari. From yesterday, I have the rash on the body everywhere, spreading fast, only from the last day. That is ashukari and spreading, erysipelas or cellulitis. Now, Kushtha is a Visarpa sheet. It is not spreading all over the body. But yes, Visarpa is a Shigra Visarpakari. Types are not according to dosha. Types are according to dosha. Vata Visarpa, Pitta Visarpa, Kafaja Visarpa. Here, Sapta Dushya Sangraha. You remember that? Rakta, Tvacha, Lasika, Maus and Tridosha Dushti are equal. But here, Sapta Dushya Sangraha, similar to the Kushtha, but Rakta Dushti is Pradhan. Are you getting point? Here, equal weightage. Rakta, Tvacha, Lasika. Here, can you see the cursor? Lasika, Maus, Tridosh, equal. Or 10%. But here, everything is there, but Rakta is most. Boom. Because it is mainly Pitta and Rakta Dushti, Visarpa. Vedana may or may not present. But here, Tivra Vedana, Visarpa. Treatment needs to be given for longer duration and Pachya is more important. Treatment, short duration. Maybe week, maybe 15 days, maybe 1 month maximum, finish. Then, Sadhya Sadhyatva, Rasa, Rakta, Mausagata, Kushtha is a Sadhya. But all other types except Ekadoshaja are Asadhya. Visarpa is not easy. Visarpa is not easy. That is something serious. Then here Kushtha, I will just mark this. Dhatu Gatavastha is present, but here it will not spread to Rasa, Rakta, Maus, Mail, Asti, Majjash. No. Dhatu Gatavastha is not there. But I think in this comparison chart, this last chart, that means this chart, Kushtha and Visarpa is the most important question for your MUHS or any university examination. It is also interesting in the oral, it will be asked. This will be asked for SAQ of 3 marks or 7 marks. I think I have made idea very clear. Describe Kushtha with Nidana Panchapanchak, that is LAQ, 15 marks. So you have to write down all. Mahakushta, Kshudra Kushta, their dosha, pradhanya, symptoms, everything you have to write down, 2, 3, 4 pages. Now we are at the last point of the Kushtha, Upadrava, that is a complication. There are these are two separate words, Upadrava and Udarka. Don't get confused, my dear friends. In Roganidan subject, in the oral, they will be asked you, what is Upadrava and what is Udarka? Can you write down? Upadrava is equal to complication. Please write down. Upadrava is equal to complications. Udarka is equal to sequelae. Sir, what is that? sequale. Sequelae. Take the spelling. Sequelae. So what is that? What is difference? What is difference? Upadrava complication exist at the time of the disease process, and udarka is after effect. After effect, disabilities, problems remaining after completing the treatment of disease. What are the remaining problems there? That is udarka. Complication at the same time. Okay. Strava, then atitrishna, jvara, atisar, dah, and dorbal. Only main things you remember. These are the complications. But udarka, large eruptions on the ears, like leprosy. You remember the leprosy patient? Here, nodular swellings are there. Forehead, here. Then falling of the nasal bridge, here. Falling, and that pressed nose. That is the leprosy. That is a disability, or what you can say, the deformity. Udarka can be deformity. Udarka can be deformity. Please write down disability and deformity. Udarka, disability and deformity. Don't forget that. And face becomes ugly in leprosy, Hansen's disease. Lack of blinking causes the ulceration in the eyes. Fingers and phalanges fall off. Very unfortunate. Now we will go for sadhya, sadhyatva. Ekadoshaja and vata kapha type of kushta is sadhya. Tvak, rakta and mausa ashrita kushta is also sadhya. But when there are two doshas and medogata kushta is yapya. What is yapya, sir? Whenever the person is following the instructions of the doctor about the medicine and about the food, it can be controlled. Sadhya is curable and yapya is a controllable. Please write down controllable. It cannot be cured. Controlled. It is under control. For example, madhumeha, diabetes mellitus. Nobody can say in the world, I can cure diabetes. No. He is a cheater. He is a fake doctor. But if anybody say, with the help of Ayurveda, I can control your diabetes, very good doctor. Very good doctor. 100 out of 100 marks. Because according to Ayurveda, madhumeha is not sadhya, it is yapya. Okay, next. Pitta pradhan, sannipatik, all doshas. Whenever sannipatik, whenever the doshas, always write down asadhya, bindas, asadhya. Three doshas, great, huh? All disturbed. Majja, asthi, shukra dushti, asadhya. Because it is going deep. If tvacha, mouse is rotten, gangrene is there, then anga, bhanga, fallen fingers, swarshabhed, swarabhed, your voice has gone. Rakta, netrata, these all lakshanas are little bit difficult to cure. Now, I am going to see you a little bit comparison. Kapal, Audumbar, Mandala, Rishyajiva, Pundarika, Sidmaka, Kanaka, Mahakushta. Kapal, V, Vata Pradhan. Audumbar, P. Take screenshot. Mandal, K. Then VP, PK, Kaphavata, and VPK. Very easy to remember. Very easy. This is non-lepromatous leprosy. This is lepromatous leprosy. Again, non-lepromatous leprosy, and also maybe sometimes can be compared with psoriasis. This is again non-lepromatous. This is lepromatous. Then this is pityriasis, leprosy, and this is lepromatous. But most can be compared with the different types of leprosy. Now, here you can see the Kshudra Kushta. Snapshot. Ekakushta V compared with the psoriasis. Charmakhya Vatakapha can be compared with the zero derma, very dry and rough skin. Kitibha Vata and Kapha, that is lichen planus, or also can be compared with psoriasis. Vipadhika, fissure in palm and soles. Alasaka is a VK. Dadru, ringworm infection, fungal infection, tinea crevis, tinea corporis, tinea unguenum, all tinea. Tinea is fungus. Charmadala, that is impetigo. Pama, that is scabies. Vispota, exanthema. Chataru, erythema, induration, and Vicharchika is eczema. Now I would like to make the screen little bit smaller. Only more 5 minutes for today, because this is very interesting for you. This is some description about Hansen, modern dermatology. Suspect, when you have to suspect that this is a leprosy patient, hypopigmented patches with anesthetic to touch, very important word, anesthetic to touch and pinprick. Then you have to examine the ulnar nerve, greater auricular nerve, and lateral popliteal behind your knee joint. These three nerves you must check: ulnar nerve, greater auricular nerve, and lateral popliteal nerve. These nerves will be enlarged and tender. Tender means sparsha satva. If you want to touch, oh, doctor, please. If there are contractures of fingers and lion-like face, the diagnosis is almost certain. In case of doubt, take a biopsy. Always Hansen is diagnosed with biopsy, and then confirm whether it is a diagnosis. Also tell you the tuberculoid leprosy or lepromatous leprosy. Now, in short, the treatment, interesting. That's why I have taken this. Tuberculoid, the most important treatment is tablet dapsone, 100 milligram, only once for 1 year. Treatment should be 1 year. Tablet rifampicin, which is also a drug of tuberculosis, 600 milligram if your weight is greater than 50, and 450 milligram if the weight is less than 50, only once in a month, but 1 year. So 12 capsules will be there. This is simple Hansen or leprosy. Tuberculoid is a non-contagious, but lepromatous is dangerous. Lepromatous leprosy, but 100% cure. You, as a family physician, tell to the patient, don't worry, be happy. Even if you have the TB, even if you have the leprosy, nowadays it is 100% curable. No worry, no tension. It is not fatal. It is not fatal. And if taken the treatment very properly and early, contractures, lion-shaped face, falling off the finger, nothing will be there. Nothing. But one has to go to the doctor. Tablet dapsone, 100 milligram OD for 3 years. Can you see here? Here OD for 1 year because it is mild. Tuberculoid is always mild. This is a type, this is not related with the TB, tuberculoid leprosy. And this is lepromatous leprosy. This is more serious. Capsule arsine, 600 milligram once in a month for 3 years. Previous was 1 year, this is 3 years. Capsule clofazimine, Hansipran, 50 milligram daily, and 300 milligram once in a month for 3 years. Now, sometimes there is a lepra reaction. Always watch a lepra reaction. In case of a lepra reaction, where the patches suddenly increase in size and number and the nerves become more painful, what to do? क्या करना है आपको? Tablet prednisolone, steroid देने का है, 10 milligram 4 times in a day for 8 to 10 days. Then gradually you have to reduce. Visolon should not be stopped abruptly. Capsule clofazimine, 100 milligram TDS for 1 month. Do not stop the dapsone or rifampicin. This is more important. My dear friend, this is all about today's interesting lecture of the Ayurvedic word is a Kushtha Vyadhi, and modern one part of leprosy is included in the Kushtha. I wish you all the best. We will see tomorrow for the gynecological lectures. Till then, take care and see you, and all the best for your studies.